Hello, good day, ladies, gentlemen, and dear panelists. Welcome to you all to the third Swiss-Chinese Life Sciences Forum. The first two forums were in the form of physical conferences in Basel. The first forum took place at Roche Tower, and the second forum took place at Novartis campus. This year, due to the COVID-19 pandemic, the forum is moved online and will take place in two sessions. The positive aspect of this change is that the audience and the panelists who are physically located in different cities in China can join us. The third Swiss-Chinese Life Sciences Forum is organized by the Swiss Chinese Chamber of Commerce, Basel Area Swiss, and Fisher AG. The Swiss Chinese Chamber of Commerce is an association organized under the Swiss law and is the point of contact and networking platform for Swiss and Chinese individuals and companies. Basel Area Swiss is a nonprofit agency dedicated to help startups, institutions, and companies to find business successfully in Basel area, namely Canton of Basel City, Basel-Land, and Jura. And Fisher is a leading full-service Swiss law firm that advises foreign domestic companies in legal and tax matters. As a tier one law firm in the life sciences industry, Fisher has advised many bilateral collaborations and investment projects involving Chinese and Swiss businesses. Today, our topic is the key challenges and learnings from the COVID-19 crisis experienced by leading Chinese and Swiss life sciences companies. My name is Fiona Gao, Senior Associate and Manager of China Life Sciences Group at Fisher AG. We have gladly invited 5 experienced panelists to share their insights with us on this topic. So first, please welcome the first panelist, Christoph Weber. He is the company secretary of the Bank of Geneva and the president of Swiss Chinese Chamber of Commerce Geneva chapter. Christoph, could you please wave to us and say a few words about yourself?
Yes, good morning, everyone, or good evening, everyone. I am Christoph Weber. I'm the company secretary or Secretary State Bank of Geneva. I'm head of corporate governance, head of strategy and public affairs. I am presently the president of the Swiss Chinese Chamber of Commerce Geneva chapter, representing Romandie, the Romandie, where we speak French. We today are serving around 200 members, mainly bankers, lawyers, traders, and especially watchmakers. And I used to be the former executive director at the World Economic Forum in Beijing, where I spent 4 or 5 years of my time founding and creating the World Economic Forum annual meeting in Dalian and Tianjin. Voilà, that's all for me. Thank you, Fiona.
Thank you. And then warm welcome to Marco Bollier. He is physically located in Switzerland now, and he is the Chief Commercial Officer at Geisslich Pharma China and the board member of Swiss Chem Beijing. Marco, could you please wave to us and give us a short introduction of yourself?
Hi, Fiona. Hello, everybody in Switzerland and China. Thanks for the introduction, Fiona. My name is Marco Bollier. I'm working for Geisslich Pharma AG in China. We are actually located here in Switzerland, in central Switzerland. We are the global market leader for regenerative products, mainly bone cartilage and soft tissue regeneration. We have been present in China with our own affiliate for more than 10 years, with the products more than 20 years. China is our most important market globally. And as you can see, I'm right now also based in Switzerland. We're also struggling with the current COVID-19 crisis, as a large share of the management cannot travel back and forth between the two countries anymore.
Great,
thank you, Fiona.
Thank you. Thank you, Marco. Now welcome goes to Jinyi Li. She is physically located in Shanghai. She's the head of forecasting and supply pharma at Roche China. Jinyi, please wave to us and give us a short introduction to yourself.
Thank you, Fiona, and hello everyone, and nice to meet you here in this virtual forum. And I'm currently the head of forecasting and supply for Roche Pharma China India affiliate, and I lived in Switzerland for almost 16 years. And last October, it was a great opportunity for me to come back to my hometown, Shanghai. And currently, my team is responsible for the overall supply chain related activities, sales forecasting, and also launch excellence, currently based in Shanghai. Nice meeting you.
Thank you, Jingyi. Now the welcome goes to Jessica Liu. She is physically located in Beijing. She is the VP Head of International Business at TigerMeds. Jessica, please wave to us and give us a short introduction.
Thank you, Fiona. Hi, hello everyone. Good afternoon. I'm waiting from Beijing. I'm working for TigerMed. It is a clinical CRO that started in China and being the #1 in China. And now we are expanding globally. About myself, I joined the company about 4 years ago, and before has always been in global pharma companies, including Hoffmann La Roche. And I also started in Basel University for about 3 years, two and a half years. It's a postgraduate program that made me travel between Swiss and China. And my job is to lead TigerMed to expand our business, our service in other countries, mainly to help the Chinese customers. And we are hoping that we can also help the customers in Switzerland and in other countries in Europe and the US to know more about the clinical trial conduction in China with our great team in TigerMed. A great opportunity to join this session. Feel like I'm coming back to Switzerland, where I used to study with. Nice meeting all of you.
Great, thank you, Jessica. Now, last but not least, welcome to Dr. Niels Eckhart. He is currently based in Basel, just like me. He is the VP Medical Affairs Europe at Beijing. Niels, please wave to us and give us a short introduction of yourself.
Good morning, good afternoon. My name is Niels. As you see by the background, I've put a picture of Basel in the back for you, for those who have been to Basel as a memory, for those who've not been to Basel, maybe as a future travel target. I'm the VP Medical Affairs Europe at Beijing, and I'm the site head for our headquarters site in Basel. Beijing is still a young company. We're just 10 years old this year. Founded in Beijing 10 years ago, we see ourselves as a global biopharmaceutical company. We've expanded from China first with our development footprint into the US and Europe. And then last year in November, we were able to launch our first own asset in the US. We're now looking forward to doing the same in Europe. This is why about a year and a half ago, I started building the European Medical Affairs team to create a strong footprint in Europe for Beijing.
Great. So thank you all for your self-introduction. And now we start our first topic. Since the outbreak of the COVID-19 pandemic, the life science sector has been under the global spotlight. From the manufacturing and the supply of masks and other protective gears, the development of vaccines and treatments, to the production of new diagnostic devices, ventilators, and pumps. And during all this time, Switzerland has experienced a difficult time just because Switzerland has no access to the seaport, and it hit some headlines as Switzerland's protective mask and protective gears were stopped by the German or Italian borders. So to fight this, we invite Christoph Weber, our first speaker, to share his experience how to help Switzerland to transfer protective gears from China to Switzerland. Christoph, could you please share with us your experience?
Yes, hello everyone. I'm not at all a fighter. I have been just acting as a volunteer in this organization. To make the story short, I received a call on the 22nd of March from the head of procurements, logistics and stocks of the Hospital of Geneva and the Hospital of Lausanne. Both of them have merged their logistical acquisitions. And the man over the phone called me as the president of the Swiss Chinese Chamber of Commerce of Romandie and said to me something extremely surprising, is that he was only able to furnish his own medical professionals with materials, including gloves, blouses, infrared thermometers, protective hats, medical glasses, and masks for only a week. And I felt extremely confused with this information. And very honestly, I didn't believe it when he said that to me. And very honestly, when he started to cry over the phone, I said something. We have to do something, and something must be done. So I received this call on the 22nd of March in the evening, and it was a Friday. And on Saturday, I started to put down and create a kind of a consortium with people here in Geneva. And over the weekend, we started to receive other phone calls from other public hospitals in Valais, in Fribourg, in Jura, and also in Ticino. So by the end of the weekend, we had a group of 14 public institutions missing materials around the 23rd and 24th of March. So we decided on a pro bono basis to organize some kind of delivery of protective material from China. So this was not at all an easy task. It was an absolute war, I can say, because I spent 45 days doing this pro bono. It was a true crisis experience. And we have set up a team of volunteers comprising lawyers, companies such as SGS, la Société Générale de Surveillance, logistical partners, public makers, and so on, who were willing to work pro bono to set up this task force. And we made it, and we brought around 98 tons of materials on the 6th of April throughout cargo flights from Cargolux, and another 92 tons of materials on the 22nd of April, again in Geneva, with the same Boeing 747 that you might have seen in the press. Again, I just want to emphasize the fact that the main requests of those public hospitals were not at all masks. It was really about gloves, blouses, infrared thermometers, protective hats, and medical glasses. This was the absolute priority. So we had to be quick, we had to be fast, and I want to underline that it was a commercial act. When we started to contact our friends in China, mainly the NDRC or the MOFCOM or the MFA, to set up this line, two questions were asked to us. Is the first one, what is it for a donation to Switzerland? And the second, is it just a commercial act? And because we are not politicians and we are fully independent, we went into after the commercial act. So we spent days and nights negotiating different contracts that the 13 and 14 institutions, public hospitals, were ready to sign at a good price, of course, to ensure this delivery. So to be transparent, we worked with directly with Sinopharm, and we were supported by the NDRC in China. Now, the interesting thing is that during this crisis management, we spent a lot of efforts contacting the Swiss Confederation to understand if there was anything else in the pipeline, if there was any other, securing plan to bring protective material to Switzerland. And it has been very frankly extremely difficult to get any kind of feedback from the Confederation, from the Swiss Confederations, from the Conseillers Fédéraux. And regrettably, we got also neither support. I just want to emphasize that I have signed on my name a cargo flight, Boeing 747 of 1.5 million Swiss franc. And this was under my name, not under the name of the Swiss Confederation, not under the name of the state of Geneva or other states here in Romandie. So we felt very much alone in this crisis management. I don't want to be too long in this story, but one thing that I want to underline, that the Swiss Confederation, not to criticize what has been done at all, that's not the purpose of it, but it has been extremely slow to recognize the lack of protective gears for our professionals. And this was really frustrating, because you had on one side the same people crying over the phone, saying, look, we are missing material, saying, look, there's absolute no problem, everything's fine, we're not missing anything at all, when on the other side, we were hearing the exact opposite. And I also want to underline one of the negative aspects of the story was that I think Switzerland has started to organize through different states afterwards, and this was good in one sense, different cargo flights with different needs, with different materials. And the fact that it was uncoordinated throughout Switzerland, I think we lost a lot of money. And price bargaining at the midst of the crisis, the pricing have been rather high for different tools and different gloves or any materials. So the fact that the Swiss Confederation has not taken its true logistical responsibility in this crisis management, I think that the Swiss provinces and Swiss cantons have lost a lot of money. So to conclude, there's a famous saying in Switzerland that we usually wake up early, but we don't usually act early. So I just want to conclude with this little expression. Thank you. Fiona?
Thank you, Christoph, for sharing. Thank you very much. And yeah, it has been a difficult time. I think for Chinese, for Switzerland, I think the a bit advantage from the China side is that China has experienced previous pandemic, and somehow China is more prepared, could be more prepared, and also the pace in China, the working pace in China to coordinate, to react much faster, is China reacts generally much faster than other European countries. So next round, we will have a round of personal experience sharing, and from the panelists, what are your experiences and observations during the COVID-19 pandemic? So I will now first start with Marco. Hello, Marco. Marco.
Hi, Fiona. Yes,
Hi.
thank you very much.
Can you please share with us what is your personal experience and observation during this pandemic?
Yes, thank you for the question, Fiona. Well, it was very interesting to listen to Christoph. I mean, I never heard that directly, but that it was really that much of an issue to ship the products from China to Switzerland. I heard it on a smaller scale. And maybe one story out of our company is also a bit going towards the direction. I mean, initially when this pandemic started, we thought, well, okay, that's going to be a China thing. It happened before. Let's stay relaxed. And what we did is immediately we have protective gear in our company. We had like 2 or 3 thousand face masks. So what did we do? We packed all this stuff and sent it down to China. And we expected, okay, that thing is done, and now let's wait until it's over. But then, just a couple of weeks later, actually, our Chinese employees in China started to ask us if they can in any way help us and start shipping protective equipment to Switzerland. So I also very much believe that on a large scale we kind of underestimated the power, the extent of this whole crisis here in Switzerland. We always thought, well, these exotic diseases over there is never going to happen here. But we were also kind of caught on the wrong foot. And even within our company in Switzerland, we didn't have disinfectants anymore, and it was not available. So we were simply not prepared. So was interesting to listen also to Christoph how this was organized even on a higher level for hospitals. Well, my personal experience when the whole crisis started, I was actually still in China. That was before the lockdown, and we had to cope with really a lot of issues. Our headquarters is based in Beijing, and Beijing also immediately implemented quite strict measures. So one of our issues was that pretty much from one day to the other, the whole sales force was stuck at home. They were not able to go to the office anymore. And I would not say that we were very much prepared for that. So specific departments, for example, like marketing, they all need equipment like special monitors and softwares to work with, and that was not prepared at home. So pretty much a large share of the organization was inoperational. And one of the first things we had to do is to kind of make sure that those guys can work again and do their job. So we also started to buy online and equip those people at home as fast as possible. I mean, that was one of the first things we have done. And a second big thing happening was that pretty much our whole market in China collapsed from one day to the other, because we are specialized. Most of our product in China go into dentistry, about 50-50 public hospitals and private clinics, and all of them, they had to shut down, most of them from one day to the other all over China, and we were not able to deliver any products anymore from one day to the other. So for 2 to 3 months we had suddenly zero sales, and we had a whole sales force all over the country which was also stuck at home. We had several people in Wuhan as well, and I mean they cannot even go out of the apartment anymore. So for us, the first and most important learning out of this was we kind of have to organize our people again. We need to give them a daily task. We need to make sure they can do their job. We need to make sure the managers can still control those people in terms of that they are working, because if you're sitting at home for 3 months and you're just used to go out and see customers every day, what are you doing at home? So we came up with a lot of tasks. We gave them like half day work schedules into the last detail. Like this morning you have to update a certain part of the CRM, a certain customer share, and just do all these administrative works you're not able to do on a daily basis. And I think a third very important part we were working on is the education part. I mean, we are, and that's part of our company philosophy, we're the market leader. So we are usually selling through education in China. This means we have a lot of seminars, courses, hands-on for the doctors in China. And that also collapsed from one day to the other because you cannot have any face-to-face meetings anymore. So like many other companies, we had to move online from one day to the other. And we started really an extensive webinar series where we had international speakers, professors, globally acclaimed experts from all over the world. We had local speakers. We had really hands-on seminars streamed online. And I think that was one of the positive side effects we haven't expected, because usually when you try to approach doctors in China, they have no time. They're working from early in the morning to the late night in the hospital, and they have absolutely no time for education. And now suddenly a lot of them were sitting at home, and we noticed some of the webinars, they were attended of up to 10,000 people. So we were suddenly able to approach a much larger crowd than we were able any time before. And still, all out of this whole difficult situation, I think we tried to make the best, and we came up with also quite some good results. And I would say that's something which is special in China. Chinese people are very flexible. They're also kind of used to deal with whatever is coming, because I felt here in Switzerland we were a bit stunned and then slow, and nobody knows really what to do. Whereas the dynamics in China are amazing. And from one day to the other, we just shifted from operation mode 1 to operation mode 2. Everybody was flexible, everybody was helpful, and in the end, the overall result was we did the best out of the situation.
Before talking about TigerMed, I want to share my personal experience or kind of a feeling. As I introduce myself, I'm heading the international team of a TigerMed, where we have a team in Korea, in Taiwan, Hong Kong, also in Europe, in Italy, and Romania, and US. So before the pandemic, I was always ask the question, where do you base? Where are you based, Jessica? I always reply, I'm based in airport. But during the past 5 months, I'm staying at home, I'm grounded. And then I have the opportunity to spend more time with my family. So that's the positive side of the pandemic. So I like to share this as some great experience. Of course, working at home, we are able to connect with all the colleagues over the world, just like this webinar. And then same, business as usual that we are always managing. And then our experience in TigerMed, as I introduced, we are specialized in the clinical trial management as a contracted organization, and we have all over the world about 5,000 staffs, and 4 of them are based in China. And once this pandemic happened, our first reaction is our staff's safe. We immediately activated our business continuous plan, and to have a daily report of all the employees through their line of reporting. And then we have a daily update whether, for example, we have about 200 staffs in Wuhan, the most severe pandemic area. And we also have a lot of trials ongoing. And then thanks to the system that TigerMed has, we were able to count how many trials are ongoing all over the country. And right now, on a weekly basis, how many projects and how many patient visits are being scheduled. So we have this data, and also the stats on our staff's situation. So we are able to understand what could be the impact of this pandemic lockdown in Wuhan, and then later on in many other places. Well, indeed, clinical trial activities was very severely impacted. First of all, a lot of patients, they are supposed to come back to see their doctors, and then they need to have a continuous drug supply to according to the study. And then we see about 60% of drop of this patient schedule visit. And then, of course, all the hospitals, doctors were putting their effort in fighting against the COVID-19 infected patient. So they were not able to spare their time to carry on the clinical trial activities, especially not to start any new studies during this period of time. So yeah, the number of clinical trial being initiated during the pandemic was also significantly dropped. Well, right before the Chinese New Year in TigerMed, we were having the effort in deploying the online communication system, Microsoft Teams. This way that we would be able to, we were hoping that we would have a more synchronized communication channel. And then thanks for this software being implemented throughout the company. I mean, not only in China, but worldwide, having all the people staying at home and then doing a lot of work remotely. The system, the software contribute greatly that we felt that we are still connected and then can carry on the daily work. I heard the previous speaker mentioning that in China, Chinese people seems to be very compliant, and then they could follow the guidance from the government. Indeed, and because of that, the pandemic was relatively quickly controlled in China. For example, in March, end of the March, a lot of the cities lockdown were lifted, and the Wuhan being the latest one, lockdown release were happened on the 24th of April. So we gradually see the recovery of the clinical trial activities, and then right now we continuously watching on the recovery, and then we see that yeah, about only 10% of the patient have the missed schedule visit. That probably would have some impact to the clinical trial data integrity. And also about 70 to 80% of the hospitals fully resume the clinical trial activities, including starting new clinical trials. I think this is very important, that the pharma industry and the CRO, we are doing clinical trials to prove the drug's efficacy and the safety, and therefore we would able to have a more robust product or drug to the market to help the patients. So this kind of a resuming of the clinical trial activities in China nowadays is given us the hope and the confidence that this business, I mean the pharma industry, will gradually recover from the pandemic impact. And talking about lessons to learn from this, as I mentioned, BCP during the pandemic to take care of all the projects and to pay special attention to the patient's safety during the trial, and also to take care of the staffs in the company, because we are basically doing the human activities. So keeping everyone health, and then is very important. So this BCP in place is very important. And also the software that linking all the people, yeah, as some previous speakers already shared, is the way that we can carry on our business. And we also need to find, instead of having face-to-face activities with the doctors, with the patients, whether we should implement more remote activities. Now we have more programs using the remote monitoring approach, that the clinical data still could be captured, even our monitors are not visiting the doctors. And then even more innovative approach being considered after the pandemic, that probably patient does not have to come back to their investigators hospital, rather to visit some neighborhood physicians, that still they can carry on the clinical trial activities. So these new approaches of clinical trial conductivity are very actively considered and even pilot after the pandemic. And this is also new to us, and then it's a lessons learned, and then pose new challenges and the excitement for us in the industry. So yeah, we have a lot experience, but also some learned, and happy to share here. Fiona, I hear that you are back, so now you can take over.
Yes, thank you very much, Jessica, for your sharing. I heard most of it, and sorry for the technical issues. And as any life experience, basically, you always need a backup plan. So today's backup plan is the phone. So I'm happy to be back here. And thank you, Beilun, for covering me when I was gone. And so a general remark to the audience, if you want to ask any question to any of the panelists, please post your question to the chat function, and we will answer your questions at the end of this session. And so now we've heard the sharing from Marco and Jessica. Basically, you have, our takeaway so far is you have to have a swift reaction plan to whatever happens, and currently the digitalization of any communication is the key. So next, we would like to hear the experience sharing from Jingyi from China. Jingyi, please.
Hi, everyone, and thank you very much giving me this chance. So I think I would like to share a little bit also from two different aspects. One is from a personal experience. Because this is actually the first Chinese New Year I was celebrating after 16 years. And I remember in 2002, when I was still in China, when the SARS had started, that all the news were blocked and the Chinese government were not as open as nowadays. So this time, I was actually very amazed that public information was very transparently communicated with the folks. And also there are a lot of digital tools in use to read out even GPS to positioning where the patients were found. You could put a location of the home and try to check where nearby there were patients found infected by COVID-19. So, I couldn't imagine back to 2002 that the government will be communicate this kind of information so publicly and in time and timely. So because I think this information, there's also pros and cons, right? So during the Chinese New Year, I think this is a traditional Chinese family reunion festivals. And I remember that starting from the third day, all our meetings, gathering were canceled. And most of my friends and relatives actually, and of course, at the beginning, everybody was a bit panicking and not happy, or even feel a bit sad not seeing their friends during this important celebration. But quickly, I've seen that Chinese people were very, very obedient and listening to the government guidance and stay at home. So the mindset switch starts from feeling safe at home. So I think that was very helpful. This, help people to build confidence that we are a united front facing the virus and launch a war against this virus, and we were confident, optimistic we could do this together. And after the lockdown, so because I'm currently living in Shanghai, the city is over 20 million people. So suddenly, after the next day, the city is empty, like a ghost city, but nobody really goes out, and everybody tries to stay at home and to contain. So I think this experience really struck me how Chinese people are dealing with crisis, as a united front, and also seeing these things positively, because because I cannot write to you. In Chinese sign, crisis meaning there are two Chinese characters. One means 危机, one 危机 means 危 is a danger. It's that we are in danger, so people try to survive. Immediately, human instinct came out with panicking, but the other is G. G means opportunity. So at the same side, people trying to see the positive side of such a danger. Now related back to business, for example, because we are dealing with supply chain. As the international passenger flights are canceled to China, we try to think out of the box and try to have dynamic inventory management to last as long as we can with the life-saving medicines for patients. And at the same time, there was one story I remember very, refreshingly, that even the driver becomes a scarce resources for delivery. Who would have thought in a normal situation? So all the driver transport medicines to severely packed Chinese provinces. They have to come back and do a self-quarantine for 14 days. So facing this kind of situation, we actually thought about from the 16 cities and provinces where they have a lockdown issue, that we have drivers to ship goods to the border and then switch drivers. So we could minimize the risk of the self-quarantine and also to fully utilize the driver resources during the pandemic period. And also, on the other hand, during the supply chain, I think that the challenge, there were many challenges, not only about the logistics. One thing I think it's also part of the learning during the COVID-19 is we see a lot of opportunities for digitalization. So as the in the planning department, our plan will never go as fast as the changes, and the market in China is already very dynamic. Even during this time, it was hard for us to anticipate what could be the mid to long-term forecast. So we have to react and be reactive to any situation would happen. And so in this time, of course, we were struggling with lack of information and not enough information or data for advanced analytics and predictive risk management. And we were willing to move from a short-term firefighting mode into a long-term thinking and also the strategic planning. But during that time, I think a lack of tools and also data transparency, it was a major struggling. But I think the team, what strikes me the most is our teams really worked with global, like over 20 teams together, really having one common goal, which is to supply to patients. And really, we were racing with time because time is really life in a healthcare company. And so everybody really tried to lead from every seat and act with urgency. So that really, touched me a lot with this spirit, that how we, move ahead with a robust trust and collaboration and have each other's back. So I think the learning is really we can be stronger together, and I truly believe the collective ability to tackle in this kind of crisis and happening, this makes us just even stronger together. And I think in the healthcare business, we also see through this crisis that a lot of diseases are becoming shifting. For example, through people's habits change now, people are trying to keep distance and avoid crowded places and wearing masks and protecting actually other people, because COVID-19 Corona has a very long incubation period. So people wearing masks actually from intent to protect others, because they wouldn't know if we are infected or not. So this would actually, this mindset shifting would lead us to a different way of working in the future. I think also a lot of great ideas are coming up from our companies, how we collaborate and how we should collaborate differently as before. So I think these are my biggest learning, and also I think we as humans this is very hard and sad. We still seeing the patient numbers popping up, but I think we could all learn from the past and also form a better now and create a much brighter future for human beings. And I truly believe that in this kind of crisis, every country, or I would say within the company, everyone is part of the solution and is contributing towards the solution finding. And this is very, very important.
So thank you very much. So thank you, Jinyi, for sharing. So basically we've learned that either from a community or even from a company perspective, to be a united front at a pandemic or at a crisis is critical and important. And also from the sharing from both Christoph and Jinyi, we've learned that the supply chain, not only international supply chain, but also domestic supply chain has been interrupted greatly during this pandemic. So now we move on to the next speaker, Niels. Niels, could you please share with us your experience from medical affairs perspective? Thank you.
Thank you, Fiona. It's my pleasure, and it's challenging to make sure that I don't just repeat what others have said. Maybe to summarize, similar to Marco, Beijing has benefited from making the experience in China when the disease came up first in China. So I think as a company, we've been very consequent. We've been almost conservative, you might say, but that has made us successful in protecting ourselves and protecting the colleagues that work with us and the people that we work with. From a medical affairs perspective, medical affairs is an area that lives from the interaction. Scientific exchange, communication, exchange of experiences, exchange of questions regarding patients. That is in the center of what medical affairs normally does. Now, without the ability to meet face-to-face, without the ability to be present in the different countries physically, we had to completely reorganize ourselves. We had an advantage. I told you at the beginning of the introduction, Beijing sees itself as a global biopharmaceutical company. If you'd asked our CEO 6 months ago where his headquarters was, he would have told you it's in Zoom. Many people smiled about it at the time, but I think today it's a common reality. All of our headquarters are in Zoom. So we were pretty much in pole position for the challenge that we were facing, similar to what Marco has explained about his teams. Yes, we had hired people for their specific skill of being good at interacting personally with people in the field. We had to do a lot of training, a lot of refocusing that has not just the simple technical task perspective, it's also got a very strong personal perspective. It's a social responsibility. A lot of colleagues in my team have been locked at home on their own. I know several team members that live alone and that have lived alone for several months now, not being able to step out. That's a very challenging situation, especially for someone who is used to be out in the field every day, talk to different people every day, live of the energy that they assimilate in social interaction. The learnings, I think we have had a really steep learning curve, and that will be our benefit as we enter the new normal. I'm sort of looking with one eye at the questions. One of the questions that I just take for myself now is the question, is there going to be a second wave? I think that very much depends how we think about the word wave. I think COVID-19 is not gone. If we try to believe it's gone, that's a bit of the ostrich phenomenon. We put our head in the sand, not to see it anymore, and then it must be gone. It is still around, and we need to be consequent and we need to be conservative of how we act whenever a new hotspot evolves, and then hopefully wherever the wave and whenever the wave comes, it will not be a wave like a tsunami anymore. It will be a gentle wave. It will be a manageable wave. I think we've learned a lot about logistics. We've learned a lot about interaction. We've opened new forms of communication. And I think one of the most important things that I have learned for myself is that in communication, things have become a lot more time critical. So despite the fact that we all assume we're sitting at home and have all the time of the world, days have gone longer for each of us. Evenings have gone shorter. Mornings have become earlier. And the key is to really put the most important thing right at the beginning of what you have to say. If you don't do that, if you communicate like we did this about half a year ago when we meet someone and have a coffee first and then slowly turn into a business conversation, that's not the way we can do this virtually. And the sooner we learn that, the sooner we become more successful, and the sooner we also regain some of the work-life balance that we may have lost during those months of lockdown.
Thank you, Niels, and also thank you for answering one of the questions from the audience. And so next, we're running out of time, so we gave each speaker a very short sharing about, in your opinion, what are the permanent impacts to the industry post the pandemic. So let's start with Christoph.
Hello, everyone again. I'm speaking here as a banker, a commercial bank. We have spent, I would say, 8 to 9 weeks distributing a bit over 200 million Swiss francs of COVID credits. You certainly are aware of the system that was implemented by the Swiss Confederation to support our small, medium-sized enterprise, including the large-size enterprise. The large-size enterprise, it was called the COVID Plus program. So the COVID program has been put in place in less than 13 days and allows the bank, actually under caution by the central bank, allows the bank to distribute credits from 0 to 500,000 Swiss franc with 0% interest. And it's a bit different for the COVID Plus credits from 500,000 to 20 million Swiss francs. So my bank has spent 7-8 weeks in direct contact with most of the small, medium-sized enterprise in our region here near Geneva. We have over 25,000 small and medium-sized companies, clients in this bank. So we were at the heart of understanding the difficulties of those companies. So at the beginning of the process, you had different strategies. You had companies who didn't know what to do with this kind of line of credits, because at the end of the day, you still have to reimburse this money. which is not an easy task for the small and medium-sized enterprise. So it's not at all a gift, and it's putting at risks a lot of strategical questions. But at the beginning of the crisis, we had a vast amount of companies coming to ask for the credit, the COVID credits, because they didn't know how I would say the crisis will evolve. So they preferred to be the first ones and get the credits and to see what to do with the money if necessary. And you had another bunch of companies who decided not to take the credit because it's not at all the best way of financing their own companies. Well, it of course depends on each sector. If you're in a restaurant, if you're in a hotel, or if you're now a tech company or whatsoever, it depends on who you are and what your ADN is made of. So we had a vast amount at the beginning of requests, and then almost no one in the middle. And now we have a kind of a second wave of demand. And the second wave is the ones who have not been asking at the beginning, and they're going to see that they are looking now that the economy is not catching as fast as expected, because we are entering the summertime, and they see that the true difficulties will be in September and October. We are lucky enough not to had too many confirmed frauds. You know that there's a list in Switzerland of about 600 frauds linked with the COVID crisis. And this list is shared by the banks between the SECO involvement. And I think we had only 3 or 4 frauds linked to the COVID crisis. Now, I must say that looking at the future, that I'm a bit pessimistic on what is going to be happening in September, October. Today, I mean, we're entering summer, it's all beautiful, but we're starting those days to see the first companies who are saying, look, we can't go forward. We need either more money, and the program ends on the 31st of July, or we're just going to be bankrupt. And this type of call will have to be made by the banks. But it's not going to be under the COVID Plus program. So are you going to be giving more money to those companies? Depend, of course, the fields, their maturity, and so many other questions. Or you're going to be fearing another wave of bankruptcy. So many bankers are now actually hoping that this credit program ends as quick as possible, and to recontact most of their clients and look with them deeply how they stand for the next 6 months. And that's the true questions. And I'm sure we're going to be learning a lot about it in the coming months. That's all for me. Thank you, Fiona.
Thank you, Christoph. Marco, could you share with us shortly what, in your opinion, will be the permanent impact to your line function?
Thank you, Fiona, for the question. Yeah, it's a really good question. And I mean, maybe coming back to the topic of also this second wave. I mean, I think it's important to understand that in China, I think we are far away from back to normal, because what we have seen just like 2 weeks ago in Beijing, there was a new outbreak, and pretty much these strict measures that we had during the worst time of the crisis are implemented back again. So like half of our staff is now working at home, where half of the staff can be in the office. So we reinstated these rotational work schedules immediately, and it's a very strict control depending on which part of the city you're living in. Either you're not even allowed to go to office anymore. So looking at that, I think it's kind of, I would also not call it a second wave. It's kind of a new normal for the time being. But again, I think that's a good thing about Chinese people. They're really flexible in adapting to new situations. I think much more flexible than we Westerners are, and somehow they cope with it, and somehow it's working. And when we're looking towards the business impact, I mean, I initially mentioned we had almost 0 sales for during the worst months. That was pretty much February, March, even April was heavily affected. But then hospitals in May started to gradually reopen, and I was also a bit worried about. I mean, our medicine is mainly non-critical medicine, so it's if you place dental implants, then this is a question of usually aesthetic and not critical medicine. So this also depends on disposable income, and I was a bit worried. Well, is this business really gonna pick up again fast? Because I mean, people might be afraid of the future. They might rather save their money instead of spending. But I was really, just speaking of China now, impressed how fast it's picked up again. And one example is Shanghai number 9 hospital, for example, is one of our largest customers. And like the first day they reopened for dental treatments, there were thousands of people queuing up to get the treatment, and the business really dramatically increased again. And we have seen now May and June, the sales figures are almost back on previous year levels. So from that perspective, I would say I'm quite positive. Well, we will see if this is sustainable in the coming months, of course, but definitely it kind of picked up again. I think another learning also out of this crisis, and that's also a bit what our company stands for, is also that we care about our employees. So also the measures we initiated from the very beginning was to really guarantee them that their job is safe. I mean, we are still a family-owned company, so our goal is we want to have workplace safety for everybody. And we implemented quite drastic cost cuttings in China for mainly events, conferences, spendings, marketing, whatever, but just to make sure that people are safe. And we so far we didn't lay off anybody during that crisis, and we also are very positive this is not going to happen. And another thing we did, we also took care of our customers. I mean, when they reopened, one of the first actions we did is we also bought a large share of face masks, of protective gear and goggles, and our sales teams went to this clinic and donated to all of our customers, to really show that we are not just there for them to make money with them, but also there for them to take care and support them when it's necessary. So the conclusion out of this, if you ask me if there's a lasting impact, I'm 100% sure this COVID situation is not over yet. It's right now affecting us much harder in markets like the US and even India, where we set up a subsidiary some years ago. There the situation is also still very complicated right now. But for China, I'm kind of positive that through the adaptability of the people, they manage quite well, and they accept the situation how it is and do the best out of it. And I'm looking quite positive into the future.
Great. Thank you, Marco, for sharing.
Welcome.
Thank you, Marco, for sharing. Jessica, could you please share with us shortly what do you think would be the permanent impact to your line function?
Okay, we actually recently have been working with quite a few companies developing therapies for the COVID-19. We actually started back to February to very quickly set up the study and then send our CRAs to the hospital, working with the doctors who are carrying the patient, and the speed to implement these type of trials. And then, you know, the passion and the sense of the responsibilities were well demonstrating the company's philosophy and even our industry. that is to save people's life. I would say in the pharma industry, particularly in China, we, in the past couple of years, 10 years, we're seeing quite a lot of companies focusing on the oncology product development. And that's definitely what to help the patients facing the life-threatening diseases. And but now, people are saying oncology become kind of a chronic disease, and it's now more like a way of finding better therapies to make people living longer or with a better quality. But with the COVID-19, it's a really alert that we, a human being, are actually very fragile. We're in front of this very highly contaminated infectious disease, and there's no therapy. And some drugs claim to have the efficacy, but need to go through the thorough and comprehensive and rational research in the laboratory and also in the human being, in the patients. So these are given all the people a good lesson, and I think the lesson will last long. That number one, you need to have very solid science, and then you have to have the passion and the sense of the responsibility to put this project in place and finish, and then in order to get the data for the use eventually to be used, and then also the spectrum of the therapies. We should focus on, say, oncology, patients who are looking for a better therapy or longer term, free of disease progress. Basically, are the people who would be able to afford this treatment, and then they are looking for better life. But the infectious disease is relatively more spread among the population, where the quality of life, their quality of life is relatively low, and the standard care of the medical larger population. We all need to keep that in mind. This is a mission and the responsibility of the people in the pharma industry. And then I do think that this as a permanent lesson to all of us, we will continue to work. And then TigerMed being the CRO company providing the service, we were proud to be involved in some of these trials. And then we feel that this is because that we share the same value, that we are here up to help the improvement of people's life. And then whenever we have the second wave or more understanding of the COVID-19 or any other diseases, continue the laboratory, continue the hard work to make things happen. That's definitely the spirit we will carry on. That's built into our gene in the company. So yeah, I want, if anyone have more interest about more details of the COVID-19 trial, that's a very different from the normal oncology trials that I'm more than happy to share, but maybe next time.
Yeah, thank you very much, Jessica, for sharing. And before we move on to the final sharing from Jingyi and Niels, just want to say we're running a bit over time. And so for anyone who has to leave earlier, our recording will be available on the event website, so you can come back and listen to the rest of it. And also we have a session 2 that is coming up on the 7th of July, so next Tuesday, and the same time. So for that, for section 2, we will share more the business development and project collaboration and investment activities between China and Switzerland. So for anyone who is interested, the registration link is open. So now we move on to Jingyi to share your insights and about what and your opinion about what are the permanent impacts to your line function.
Okay, thank you, Fiona. Just respect of the time, so I'll keep it really short. I think I've mentioned that about the speed, and I echo a lot what Jessica just shared. So from a supply chain perspective, I wouldn't want to fall back to the functional silo. I really see a very positive collaboration and very robust collaboration during the COVID-19 crisis within our company. So definitely we would like to continue this way of working. And also I think the digital tools really change the way we communicate and connect. So I believe as a trend in the future for healthcare company, we definitely need to think about how to deliver the last miles, how to deliver really truly to patients, and think about how we provide our different therapies in more innovative way. So I think all in all, we really delivered much faster and better than we could imagine possible. And this is possible without compromising on quality and compliance. So from a speed point of view, how to deliver to patients, I think there will be a lot of opportunities and in combination with digital tools, with a strategic partnership internally as well as externally to move ahead and try to, deliver for our whole society the best innovative therapy. That's all from my side.
Thank you. Thank you very much, Jingyi. I think as all the other speakers have shared, the goal of life science company or industry, no matter which function you're coming from, patients is number one that we care about. So then we move on to Niels. Niels, could you please share with us your insights?
Thank you, Fiona. I think at the end of this and in preparation of the new normal, what has very much changed is the element of quality. When in the past, a touch point with a healthcare provider would have been maybe 5, 10 or 15 minutes. Today, we may have fewer touch points, but the touch points have become a lot more intense. The conversation, the delivery of information has a lot more quality. If I look back at the numbers specifically in my team, numbers went down in March and April. They started to stabilize in May, and now we're back to where we started. So we have caught up in terms of number of interactions. We certainly have exceeded in the quality that we can deliver, that we're allowed to deliver, that the healthcare provider is willing to accept. We're also being challenged. This is not a situation where you walk into someone's office and you have their time until they compliment you to leave. This is a situation where we deliver information on demand, like this webinar today. We're over time, we still have almost 50 people on the line, which means that they like to listen to us, which means that somehow we've provided a value to them, and this has been worth their time. And I think this is also some element of the new normal, that whatever we do in the virtual world, whatever we do as webinars, as education, as patient-centered information, if it is not of quality, people are going to vote with their feet and leave. And I think that is one big challenge that all of us, and especially in medical affairs, we're facing. And I believe the last months have taught us a lot, and we're still on the learning curve to excel and exceed here.
Great, thank you, Niels, and thank you for all the panelists for sharing and stay with us till now. To conclude that, companies in the healthcare and life science sectors are pushed to work even harder, innovate faster, collaborate and resilient at an unprecedented pace due to the COVID-19 pandemic. And as the world attempts to recover and return to the post-COVID normal, we anticipate that there will be an increased use of digital technology for all line functions and to align better and to serve better for patients. So now I would like to conclude today's session for the third Swiss Chinese Life Sciences Forum. And as I mentioned earlier, the second session of this forum will be on the 7th of July. So welcome to register, and we will see you next week. Thank you for all the panelists. Thank you. Have a good day.
Thank you. Thank you, Fiona. Bye,
Thank you.
everyone.
Thank you for having us. Bye-bye.
Bye-bye. Thank you.
Bye.
Thank
Bye-bye.
you all. Bye.